Good afternoon. My name is Neurological, and I will be performing the neurological health assessment. This is my client Nikita Sinu, who is going to assist me with this procedure. Okay, so first you always remember, you're supposed to always perform your hand medical washing procedure, and you should always introduce yourself to the patient. Make sure and explain to the patient why this procedure is being done. Okay, and you should always make sure your patient has their privacy. Okay, you got to make them feel comfortable and to know that you are here to assist them with any situation that you're going through. Okay, so again, I already performed my medical hand procedure, and now I am going to enter Mr. St. Luke's room. Okay, so once again, I already performed my hand medical washing procedure, and I'm going to introduce myself to Mr. St. Luke. Okay? Okay, so good day, Mr. St. Luke. My name is Neurological, and I will be performing the neurological health assessments. Okay, so what I'm going to do is test for your mental status, and then I'm going to work on to your cranial nerves, and then I'm going to work on your superficial reflexes and your dependence. Okay?
Okay.
All right. So first of all, I'm going to start off with your mental status,
Right.
and I want to test to see that you are alerted. Okay? So, Mr. Sinu, can you tell me what's today's date?
The 24th of the 10th month, 2020.
Okay, so he is then now explaining to me that the day is stated the 24th of the 10th month of October, and the year is 2020. Okay, so he is alert and oriented, and he's well groomed, and he's not confused. Okay, so now I am going to ask him a few more questions, like his family history, and if he had any mental defects, like if he had any mental disorders or any depression or any suicidal thoughts. Okay. Okay, so Mr. St. Luke, have you know if any of your family members have any mental disorders or any signs of depression or any mental illness or anything like that?
No, ma'am.
No? Have you had any of those mental illnesses or depression, or have you ever been concerned, like thinking about suicidal thoughts?
No, ma'am.
Okay. So again, he's alerted me that he has not been diagnosed with any mental illness. He's not experienced any suicidal thoughts. So again, he is well, and he's alerted, and he's oriented. Okay. So now I'm going to check for his cranial nerves. Okay. Okay, so now I'm going to check for his cranial nerves. Okay, so we have cranial nerve 1, which is the olfactory. We have cranial nerve 2, which is the optic. We have cranial nerve 3, which is the oculomotor. And we have cranial nerve 4, which is the tricochlear. And we have cranial nerve 6, which is the abducens. We have cranial nerve number 7, which is the facial nerve. Sorry, and we have cranial nerve number 5 was the trigeminal. We have cranial nerve number 8, cranial nerve number 8, what is the vestibular collar, and we have cranial nerve, which is cranial nerve number 9, which is the glossopharyngeal, and then we have cranial nerve number 10, which is the vagus. We have cranial nerve number 11, which is the accessory, and then we have cranial nerve number 12, which is the hypoglossal. Okay. Okay, so now I'm going to start off with cranial nerve number 1, which is the olfactory. I'm going to present something pleasant for Mr. St. Luke to smell. I don't want to give him something where it's foul because I don't want his gag reflex to react. Okay, so I'm going to have Mr. St. Luke to close your eyes for me, and then he's going to tell me the smell of this item.
Pumpkin spice.
Okay, so he is now correct, and this is pumpkin spice. So his nerve is intact. So next I'm going to test for his optic nerve. Okay, so I'm going to have him to cover up his left eye and then his right, and then he's going to look straight into my eyes without moving his eyes. And he's going to tell me how many fingers I have holding up, okay? Okay, so can you stand for me? And I'm going to make sure he's like at least 12 feet away from me, okay? And I'm going to show him, I'm going to use this procedure midline way and up and down, okay? Okay, so can you cover your right eye for me? And I want you to look directly into my eye.
3, 3, 2, 1,
Okay, good. Next eye.
1, 2, 3, 3, 2, 4.
Okay, good. And now what I'm going to let him do is I'm going to let him, from this angle, read the letters on those box on top of the refrigerator. Okay? So can you turn around for me? Can you read those words on the box by covering your right eye?
Call out the letters or
The letters.
K, E, L, L, O, G, G, S.
Okay, left eye.
R, I, C, E, K, R, I, S, P, I, E, S.
Okay, both eyes. Fall it off, get off.
K, E, L, L, O, G, G, S.
Okay. So now he has 20/20 vision, okay? So he has both vision of left and right eyes intact. Okay, so you can have a seat now. So now I'm going to test for 3, 4, and 6. I'm going to test for his oculomotor. And then I'm going to test for his trochlear. And then I'm going to check for his abducens. So, can you come up a little bit? I'm going to take my pen light. And I'm going to check for his oculomotor. And I'm going to check to see if his eyes on both the left and the right side constrict. Okay? If they respond to light. Okay? So, okay, so there we go. Right eye has constricted. Left eye has constricted. to light. So again, his eyes has constricted to light and it is reactive to light. He had a great response to light. Now I'm going to take my pen and I'm going to check for his accommodation, okay? And I'm going to rest it on his nose. Good. And then I'm going to move it up and down and see if his eyes respond to up and down and side to side. And I'm going to test to make sure that he don't have any fish mark, okay? Okay. So now I would say that all three nerves are intact. His eyes is nice. His pupils are equally rounded, and he has good accommodations and coordination, and both are equal, and both is response to light. Okay. So next we are going to check for the facial nerves. Okay. Which is the cranial nerve number 7. Okay? So, what I want you to do is close your eye. Open, close your eye. Okay, can you puff up your face? Can you smile? Can you frown? Can you frown? Like, can you do that? Okay. Okay, so he did that without any difficulty, okay? So now I'm going to check for cranial nerve number 5, the trigeminal, okay? So I'm going to take a pen, and he's going to now tell me if he feels like it's sharp or is it dull. I'm going to test his stimuli to pain. Okay? So can you close your eye for me, Mr. Sinuk? You could use a bobby pin, or you could use, I wouldn't say a knife, but something sharp or a hairpin you could use. And then he's going to tell me if he feels, if the pin is sharp or is it dull. Is it sharp or dull?
Sharp.
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 Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Sharp or dull?
Dull.
Okay. Okay, so cranial nerve number 5, the trigeminal is intact. So he responded to the sharp and the dull pain. So now I'm going to test for cranial nerve number 8, which is the vestibulotrochlear, which is for your hearing, okay? So now I'm going to use my fingers, and then I'm going to whisper in the other ear, and he's then is going to respond back to me to let me know if he was correct. Can you come up some more? Okay. So, Mr. St. Luke, can you tell me? I'm going to whisper into his ear.
Apple and banana. Cat dog.
Okay, so his hearing is intact. I whisper into his ear, and he could distinguish what I had said in both ears. So next I'm going to test for cranial nerve number 9. Okay? So with cranial nerve number 9, I'm going to test with a glossopharyngeal. Okay, so I'm going to have him to open up his mouth to check his vulva, to make sure it's up. Good. Very good. So his vulva is midline to the tongue, okay? So it's intact. Okay? I'm also gonna ask him to use resistance. So keep it up. Use resistance. I'm gonna apply resistance and see that if he can open up his mouth. Can you open up your jaw? Okay, so that is intact. Alright? So now I'm going to go on to cranial nerve number 10. Cranial nerve number 10 is the vagus. And then I'm going to take my scapula and I'm going to check his gag reflex. So can you open up your mouth for me? Oh, so that is intact. Okay. So now I'm going to check cranial nerve number 11, which is the accessory nerve, okay? So I'm going to put my hands on his shoulder, and then I'm going to apply resistance and see if that he could push away from me. Can you?
What's that?
Can you move? Can you move?
Yeah.
Can you move your shoulders up and down against my resistance? Okay.
Yep.
So that is also intact. And now I'm gonna test for his cranial nerve number 12, which is the hypoglossal, okay? So I'm gonna have him to long out his tongue to check to see if his tongue is midline, okay?
Okay.
Okay, so can you move your tongue left and right? Okay, so again, this is, he has been long out his tongue, and his tongue is midline, and he was able to move his tongue left and right and without no difficulty, okay? So this is my test for the cranial nerves, okay? Okay, so now I'm gonna test for Mr. Sindhu's sense of vibration. So I'm gonna use my turning fork and I'm gonna place it on his mastoid and then the end tips of his fingers. And then I'm going to use it on the end tips of his toes, okay? Can you feel that?
Oh, yeah.
Can you feel that?
Yes, ma'am.
Can you give me your toes?
Oh, yes, yeah.
Can you feel that?
Yes, ma'am.
Okay. So his sense of vibrations is also intact. Okay? Okay, so now I'm going to check for Mr. Sindhu deep tendon reflexes, okay? So now I'm going to get him to rest his hand right here. And I'm going to feel for the deeper tendon. And I'm going to take my scope and I'm going to tap it. And the hand, I'm going to need you to relax, okay?
Okay.
Just relax. I'm going to need you to relax. Alright, so both hands have respond to jerk. And now I'm going to ask him to sit higher so that we can see that his knee respond to the stimuli. Can you sit right there? Okay. So I'm gonna use his knee. Make sure your knee is relaxed. And then you're gonna see his knee jerk. Your knee is relaxed. You relax? Okay. So I'm gonna hold up here. Oh, wow. Are you relaxed? You relaxed? Oh, there you go. Okay, so his knee had jerked. Okay, get it. All right. Good. So both his knees had respond to the procedure. Okay? So next, I'm going to have him to sit here. Can you sit down? And I'm going to check for his plantar reflex. I'm going to take my scope and I'm going to form a J around from bottom of his foot up to the curve, and then his foot supposed to respond. His foot supposed to curl in. All his toes supposed to curl in. Oh yeah. Great. Next foot. Yep. You were supposed to laugh. Awesome.
That was joking.
Okay. So now I'm going to ask Mr. St. Luke to lay here on the couch. Can you lay here for me? And rest your 2 foot up here for me.
Okay.
And then I'm going to ask him to I'm going to apply pressure to his foot to make sure his plexus is intact for resistance. Can you push? All right.
Yes.
Can you push down?
Yeah.
Awesome. Good. Okay. Those are intact. Now I'm going to ask Mr. Single to sit back here for me. Sit right here for me. And then I'm going to tell him to get his foot and use his foot to line up and do this. Can you do that? No. Can you? Take this foot and rub it against his foot like that. No, like do it like that. Good. Next foot. Good. And this is now I say all of his reflexes are intact. He has no tightness. It's free of movement. And this is my assessment for the neurological assessment. Thank you.